Good morning and good afternoon. My name is Maisha Hutton and I'm the Executive Director of the Healthy Caribbean Coalition. We are delighted to welcome you to this, our 5th annual Caribbean Alcohol Reduction Day, or CARD 2020. CARD is an annual joint initiative of HCC and partners, PAHO, CARPHA, and the OECS Commission, with the aim of raising awareness about the harmful use of alcohol in the Caribbean as one of the major NCD risk factors. Over the past 5 years, CARD has sought to raise awareness on a range of issues, including youth and alcohol, alcohol and cancer, and most recently last year, alcohol and women. This year's theme is alcohol and COVID-19, and the objective of this webinar is to reflect on the alcohol consumption patterns over the course of the pandemic, the reciprocal impact of mental health and alcohol consumption and related harms and comorbidities, government and alcohol industry action during the pandemic, and priority alcohol policies and programs. We are extremely pleased to have a diverse panel of experts presenting today who will share their unique perspectives on the linkages between alcohol and the pandemic. But before we begin, I would like to introduce one of our partners to deliver brief welcome remarks. Dr. Tamu Davidson is the head of Chronic Disease and Injury Department in the Surveillance, Disease and Prevention and Control Division at CARPHA. Dr. Davidson?
Hello, good morning. Thank you for inviting CARPHA to be a part of this process. I would just like to acknowledge all of our partners here today. Dr. Montero from the Pan American Health Organization, Professor Maharaj from the University of the West Indies and advisor to HCC. I'd like to also acknowledge Dr. Dillett from the Bahamas, who is a consultant psychiatrist, and Ms. Clark Mendez, researcher and youth advocate, and of course, HCC for inviting us to be a part of this process. It has been a long year with the Caribbean region responding to the COVID-19 pandemic. And certainly, this has raised a lot of the inequities and issues related to the use of alcohol and its impact on not only non-communicable diseases, but also communicable diseases. So the COVID-19, alcohol and COVID-19 is a very timely topic for us as alcohol continues to be one of the most commonly used and abused substances throughout the region of the Caribbean. This seminar and webinar will help to inform us or to support the efforts of the Caribbean region in accelerating and scaling up our efforts to address the harmful use of alcohol. CARPHA, in support as a secretariat and supporting the CARICOM, will be working with member states to develop a regional strategy to address this important topic. Every one of us knows someone who has been impacted in some way and may even be abusing or misusing alcohol. It's imperative that as a Caribbean region, we address this particular public health problem, which there are many best practices and what we call best buy solutions, which have been developed by the World Health Organization and which we'll hear today. So it is very important as we join many of our stakeholders, you, our audience, everyone in the Caribbean region, everyone has a stake in this. And so let us all work together towards reducing the impact of alcohol on our population and also bearing in mind the unintended consequences of COVID-19 that we will need to address, along with the other public health issues that we face in our region. Thank you for having the Caribbean Public Health Agency, and we look forward to hearing the deliberations from today's webinar.
Thank you, Dr. Davidson. And before we get started, I wanted to just address a few housekeeping matters. We are using the Q&A function for question and answers, and we are actually oversubscribed for this webinar. We have a maximum of 100 and we've had about 230 registrations. So we are streaming live on Facebook. If you get popped off and you need to come back on and you're not allowed in, you can use our HCC Facebook Live page, and you can let any colleagues know that this is live and they can see the webinar there. So let's go ahead and begin with our first presenter, Dr. Maristela Monteiro, who is the Senior Advisor in Alcohol and Substance Abuse at PAHO in Washington. And she's going to share with us the results of a survey on the impact of COVID and alcohol in the region. Dr. Monteiro.
Okay, here I am. Good morning, everyone. Thank you for this opportunity. And I'm going to present to you briefly some information about the situation of alcohol consumption and harms in the Americas and the results of the survey we conducted in the region with specific emphasis on responses from the Caribbean. Next. We published last month the regional report on alcohol and health in the Americas 2020, which follows the Global Status Report that was published by WHO in 2018. There are some data that has been updated, but most of the information, especially on policies, are the ones that member states submitted to WHO and allowed for that global report. As you can see, the Americas have on the right side, per capita alcohol consumption on average of 8 liters per capita, meaning 17 grams of pure alcohol per day, every day of the year for the whole population. In 2016, which is higher than the global average and a little lower than the European average, which is the highest in the world. And the same number, if you divide just by the drinkers, not the whole population over 15, but only those who reported to have drunk at least a drink of alcohol in the previous 12 months, that per capita consumption goes up to 15 liters per capita and or 32 or almost 33 grams per day. That's equivalent to 3 glasses of wine or 3 beers a day every day of the year, combined men and women. And you divide by sex and you get even higher averages. That indicates that the average consumption is high, obviously, and is very skewed. That a proportion of the population who drinks excessively, and that proportion is very high. Next. So here, just very briefly, you can see on the left side that you have, of all adults, 56.7% they are current drinkers. Of those, you have 23.4% who are heavy episodic drinkers, and 9.2% of the population with an alcohol use disorder. And you can see the differences between males and females. Males drink more and drink more often and have higher rates of alcohol use disorders. Next. The trends are not really positive in the region. As you can see, this is comparing 2010 to 2016, and the changes in per capita consumption were very minimal. And about almost half of the countries had some decrease, but like very small decreases, and some other countries, the other half, as you can see, have increased, and several countries in the Caribbean have increased during this period. And remembering that 2010 was the year that the global alcohol strategy was adopted. Next. In terms of deaths, we have 379 deaths a year in the region, representing 5.5% of all deaths for all causes. And you can see that there is a very important role of injuries in the region, way more than NCDs related to alcohol. Next. And you can see here why, because among 15 to 49 years old, in the Americas, we have among the main leading causes of death, those related to injuries, to violence, and alcohol as a contributing factor there. And this is why it's so important, those figures. Next. And in deaths in years of life lost to disability or premature mortality, again, we see the role of intentional and non-intentional injuries, but we also see the importance of alcohol use disorders and digestive diseases like liver diseases in bringing all these almost 19 million years of life there are lived with some disability in the region, meaning 6.7% of all deaths in the region. Next. So, and finally, in alcohol use disorders, especially among women, we have now the highest prevalence in the world of all regions, and that's very worrisome, and the second for men in the world. Next. So given that scenario, when the epidemic started and the pandemic started, and alarms were raised about the possibilities of what was going to happen with alcohol consumption. Is it going to increase, decrease, not change? Businesses have closed, but above all, many the concerts, the events that are done with the sponsorship of alcohol have stopped. Parties, especially those linked to universities or in public festivals, they all were canceled. So we thought about developing a standardized and anonymous online survey in all countries of the region, in the Americas, except the US and Canada, because very similar surveys were already going on there. And the data collection was between the 22nd of May to the 30th of June, and including only those with 18 years of age who consented, and they reported that they didn't leave their country since March 15th, where many of the lockdowns happened in several countries. It's important to recognize this is a non-probabilistic sample. You cannot generalize that for the whole population in the region or in any country. People were reached through various communication platforms and on their own will. So it is a skewed population of respondents, but is the largest survey conducted on the topic of COVID in Latin America and the Caribbean to date. Next. We cover demographics, alcohol, living conditions, socio-demographic characteristics, who was living in the house, what precautionary measures they adopted, alcohol consumption in 2019 and alcohol consumption during the epidemic, as well as distress, most of all, and not all the range of negative mental health symptoms, but those related to stress, anxiety during the pandemic, and as well as quality of sleep. Next. So we got 12,328 respondents from the whole region, and in the English Caribbean, basically non-Latin Caribbean, only 403 responses. So you need to be cautious about the results, and when the numbers were too low to do analysis, I'll present only regional results. Next. This is the distribution of respondents by country, and you can see there were very low responses by most Caribbean countries. Next. This is the general information about the regional sample. We had more women than men, younger cohorts, mostly between 18 to 39, and it was a mix, but more whites or a mixed ethnicity or race. And it was a well-educated sample as well. Over 90% of respondents across the region had at least completed high school. Next. So here we get in the region and in the Caribbean, the prevalence of drinking, people reporting drinking in 2019 and then in 2020. And for this survey, we got that there was less people, less prevalence of drinking overall in men and women, men drinking more than women. And but you can see the prevalences are above what we report in our general surveys in most countries. So this a sign that this is not representative. So mostly drinkers responded to the survey, but there was a reduction during the months of the pandemic. Next. The beverage, there was a change in the beverage. We couldn't analyze that for the Caribbean, given the numbers, it would be very difficult, but there was a tendency towards stronger beverages, more, less beer and more wine. Next. And here it was, I forgot, was not this, was the illicit that we didn't do for the Caribbean, was there was a tendency to decrease beer, also increase a little bit wine and slight increase in spirits. Next. Illicit alcohol. And we know there is not very common, it depends on the country, the use of illicit alcohol or informal alcohol, and you cannot fully compare 2019 and 2020. Why? Because we asked for the frequency up to a few times a year that in 2019, but you can't really during those 2 months or the 4 months of the year ask the same question. So this sample reflects only for the 4 months of the year what they drank. But on a weekly basis, you can see that it has increased in 2020 from 1.9 to 3. Daily, a slight increase, 0.4 to 0.5, and monthly also more than double. 2.2 to 4.9% of people reporting their consumption. Next. In heavy episodic drinking or binge drinking are defined by 5 drinks per occasion, at least once a month. We asked that in 2019 and 2020, and you can see that same decrease in reporting of heavy episodic drinking. But what is important, both in the region as a whole and in the Caribbean as well, is that still in the case of the Caribbean, over or about a third of all men who reported their drinking. And if this is not only among drinkers, is during the pandemic, 32% of men were reporting heavy episodic drinking and 16.5% of women doing that. The rates were higher for the region as a whole, but we have less numbers also in the Caribbean. Next. This change, because we asked the same question, this is within subjects, we asked the same subjects the same question, we could analyze those who reported heavy episodic drinking in 2019, what happened in 2020, and those who didn't change their the frequency of heavy episodic drinking are reported as no change here. But a caution again, this includes those who never did have episodic drinking in 2019, neither in 2020. So they would be in the group of no change. And the other half, or the other portion, will be people who reported a frequency of heavy episodic drinking and continue with that same frequency during the pandemic. This would be a no change. And we do have some analysis that were done after the report was published. We are doing that now for scientific publications, in which we examine what determines this increase, for example, in heavy episodic drinking or during the pandemic. We got about 13%, between 10 and 13%, according to sex, that increase during the pandemic, and people, about a third or less than a third, that decrease the frequency of heavy episodic drinking. Next. And that was related to age, and you can see younger people decrease more, and not so much the second group from 30 to 39. Next. And help-seeking behavior to reduce the drinking. We asked those who had, this analyzed only those with heavy episodic drinking, if they try to cut down on their drinking. And the vast majority never seek any help. When they do on their own. Next. We also ask all these questions on mental health impacts and the quality of sleep. Next. And we analyze then the relationship with, well, this is the distribution in men and women. You can see very high prevalence of distress. Next. And yeah, there was a relationship with drinking, but particularly with heavy episodic drinking. The more feelings of distress, the more heavy episodic drinking. Next. And income negative correlated. The more income, the more drinking, meaning the less income people drink less. Next. And that had a relationship with emotional distress. The less income people reported, the more distress they reported. Next. So there are several limitations. I'm finishing up. The small sample size in most countries would not allow for country individual analysis. The overall results reflect the countries that responded the most, and is a sample of self-selected respondents, and it may not represent the current situation. We also know that people with more drinking or have drinking problems tend not to answer those surveys, as well as homeless or people more vulnerable to alcohol problems. And we only reached the first month of the pandemic. But the results were consistent with similar surveys done in Europe and Australia. Next, but not in the US. In the US, there was more reports of increase. So here, finally, despite this low participation, we can see that about a third of men report heavy episodic drinking, and we are seeing reports of domestic violence and neglect in the household that may be related to that. We don't know, we couldn't ask that. The higher the income, the less the ability, the less impact of distress, and also more drinking, and help-seeking behavior is very low overall, either in the sub-region or in the region, and so efforts need to be made in that regard to provide and make it accessible screening and brief interventions for everyone. Next. I think that is, I acknowledge several people. Thank you very much. Sorry for the time.
Thank you, Dr. Monteiro. That was excellent. And I was particularly struck by the last few slides on mental health and the link with COVID. And we've seen that there's been an extraordinary connection with mental health and COVID. And so now we're going to turn to Dr. John Dillett, who is a consultant psychiatrist and mental health professional based in the Bahamas. And he's going to share clinical perspectives on alcohol and COVID. Dr. Dillett.
Good morning, everyone. To all our listeners and our viewers across the Caribbean, it's indeed a privilege and a pleasure to be with you today. So I'm going to give a brief presentation on alcohol and COVID and the mental health effects. Next slide, please. These are just a few of the things that we're going to go through. Some of the changes in purchasing habits that we've seen around the world, health and social risks associated with alcohol and COVID-19. How does it actually affect a person's risk of contracting COVID-19 and the burden on the community? Next slide, please. So the understatement of the year, COVID-19 is unprecedented in its impact to everyone's day-to-day life, from your work, from your relationships, to just your ability to go outside and relax and enjoy what life has to offer. All of us have had a serious decrease in our ability to move around, to congregate, and to express ourselves in any particular way. Alcohol, for persons who drink alcohol, and there are many persons who use alcohol responsibly and some persons who do not, they have found that it's become increasingly difficult in the advent of lockdowns and restrictions to gain access to the substance. Next slide. So Dr. Montero gave a very good presentation about what's happening in the Caribbean. And I thought for some comparison, we'll look at some of other developed countries and see what they're doing as well. Online alcohol consumption has increased significantly. Some countries report increases of anywhere between 50 to 500% increases in alcohol consumption. Why is this important? Because as persons are moving from a lockdown phase with restrictions where you can't travel, you can't go out of your home, many companies have sought to try to fill that gap by delivery services and takeaway services. Why is that important to us? Well, it does mean that many of the controls that persons may have had in terms of not selling alcohol to minors, in terms of not giving persons who are already intoxicated more alcohol, or ensuring the quality of these substances are fit for consumption. We found that in many cases, these issues have now arisen and are important public health concerns. Next slide, please. So many of these companies have actually kind of taken advantage of some of their customers. Some persons order alcohol online because they can't drive. They're already intoxicated. Other persons order alcohol because they may not be of a certain age. And we found that some of the delivery services actually leave because of the so-called no contact delivery that is very popular in many places of the world. They actually would leave the packages at the door and not confirm who is actually purchasing the alcohol. And therefore, many of persons that are at-risk populations have greater access under these new orders. So many countries, including the Bahamas, actually has taken a stance where we're regulating and not allowing for those delivery services to be open. We've had quite a number of controversy, and it'd be interesting to see if this has happened in other Caribbean islands, where police have had been called to shut down operations, and online websites had to be monitored to ensure that these particular services that may have not been fully licensed have been restricted, because we realized that persons who were most at risk were perhaps being compromised. Next slide. So why is that all important in terms of people's behavior? As we know, persons with severe alcohol consumption issues will look for alcohol regardless of the situation on that particular island or country. I've had, as a forensic sub-expert, a sub-specialist, I've seen many clients who've actually subverted restriction orders and curfew orders in an attempt to gain entry to alcohol and other illicit substances. So quite a number of our psychiatric clients, for instance, have been picked up by police for breaking curfew or for petty crimes because they were actually looking at drug-seeking behavior, alcohol-seeking behavior. So the health risks certainly are there. People who do not deal with stress very well they tend to see an intensity of their mental health issues. These are vast. It includes, but is not only anxiety and depression. We know that an increase in stress, as Dr. Montero said, leads to potentially an increase in alcohol use. And this, in a sense, can lead to alcohol dependence, which is a more severe form of alcohol use. And that's because of the tolerance that people develop. As you drink more, your body gets used to that level of drinking, and you require more drinking to be able to have the desired effect. We know that alcohol can cause disruptions in your sleep patterns, and this can cause irritability, feelings of anxiety, lethargy the next day. And the more days that you drink, the more likely you're to feel this way, and you can develop more significant disorders, such as anxiety and depression. We noticed locally in the Bahamas that there's been an increase in calls to hotlines and police stations regarding domestic violence. Consuming alcohol in the home in itself could be a risk, especially if the use is more than the average. We've seen that this has resulted in a number of issues where persons have presented themselves to emergency room services because of injuries, self-harm, and in some cases, even the abuse of members of the family, such as children. Also, of course, alcohol can cause many general medical issues. It can cause cardiovascular issues, such as raising your blood pressure, enlarging the heart. And for populations that already have many significant types of non-communicable diseases, such as hypertension and diabetes, these can simply complicate those conditions and cause persons' disorders and illnesses to be even more severe. What are the social risks? Well, certainly persons, if you have severe alcohol dependence, you're going to divert your funds to buying alcohol instead of essential items. Certainly, we're more conditioned to drink alcohol if it becomes a part of online socialization. Promoting events that use alcohol also can raise the complete use of alcohol among society, making it more socially acceptable. Healthcare workers who are already at risk because of the nature of their job, one of the cultural ways that we deal with stress, especially in the Caribbean, is to drink. And of course, children and adolescents, because alcohol may be more accessible at home because persons have more alcohol at home, they may be exposed to drinking alcohol at an earlier age and therefore have other issues as well. Next slide, please. So, alcohol and the risk of COVID-19 infections is extremely important. For those of us who may not have had the coronavirus as yet, we're certainly still susceptible, and even persons who have had the virus, you are at risk perhaps for getting the virus again. So what can we do to protect ourselves? We know that drinking alcohol, especially in high quantities, can affect the immune system. So it could make us slightly more likely to get infections such as viruses, which COVID-19 of course is. In terms of our social health, if we drink copious amounts of alcohol, it can disrupt our disinhibition, which means that we're more likely to make poor decisions. So instead of wearing our mask and being socially distant and whatnot, we tend to let our guard down and we forget about these things when we're intoxicated. And as such, we put ourselves and our families at greater risk. Alcohol causes problems in all aspects in our life if the drinking is abnormal and severe. So we have to be mindful of that. Even though alcohol use may be down in certain areas because of persons' ability to purchase alcohol, as Dr. Montero said, we actually have also found persons who've resorted to other substances that might be a cheaper option. For some individuals, that might be cigarettes or even marijuana. So we do see also another effect where persons are also abusing other substances. We've had some persons with severe alcohol disorders who have resorted to using things like rubbing alcohol, for instance, which of course is very abrasive and can cause many serious general medical issues. So it's incumbent on all of us to be mindful of those persons who may drink responsibly and have an increase in their alcohol use because of the stress, but also of course our loved ones and the members of our community who already have heavy drinking concerns, and they might be at the most risk. And from the slide that Dr. Montero said, many of those individuals may not seek help. And so it's incumbent upon loved ones, family members, and the community to ensure that those persons know that there are resources available for assistance. Next slide, please. And so the vicious cycle that we see regarding alcohol consumption when it's very, very heavy and the impact it has on the community, rising stress levels, increased severity of illness, a very negative impact on everyone, including the person who is at risk, difficulty in accessing services because of COVID-19. For instance, even our local psychiatric hospital, the Sandlands Rehabilitation Center, we've had issues with even being able to accept clients because of outbreaks of COVID at different times during the pandemic. And of course, this just simply adds more to the rising levels of stress and isolation that our citizens feel. So this, in a very quick nutshell, is the impact of alcohol and COVID-19 on the Caribbean and the world. Next slide, please. These are some of the resources that we use, including the World Health Organization. Next slide. And I just want to say again, a very hearty thank you to the HCC for the invitation. And it is indeed a pleasure to be a part of the 5th annual Caribbean Alcohol Reduction Day. Thank you so much.
Thank you, Dr. Dillett, for that presentation, which was very informative. I was particularly interested in your discussion on social services and health services in the community and how countries have responded and how they will have to change their or adapt their services in this unique pandemic setting. You also mentioned the impact of alcohol and the pandemic on young people. And next we have Ms. Safia Clark-Mendez. She is a recent MPH graduate and a volunteer researcher at the Healthy Caribbean Coalition. And she actually pulled quite a bit of this 5th annual Caribbean Alcohol Day together. So thank you very much, Safia. Safia is going to speak to us about the mental health and substance abuse amongst youth during the COVID-19 pandemic. Safia.
Good morning, everyone. I want to thank HCC for the opportunity and thank you all for participating. I'd also like to thank Dr. Dillett and Dr. Monteiro for those very interesting presentations. So yes, as Maisha said, I'm going to be giving the youth perspective on mental health and substance use during the COVID-19 pandemic. And next slide, please. So as Dr. Monteiro and Dr. Dillett have emphasized, the pandemic has given rise to a collective experience of distress and mental health challenges globally. And even though we don't know the exact nature of the relationship, we do know that there's a strong association between mental health and alcohol use, as Dr. Monteiro's data showed. We also know that alcohol use among Caribbean youth is already very high. Next slide, please. So in approaching this discussion, I wanted to cover 3 main questions. First, I wanted to understand how exactly young people were experiencing mental health during the pandemic. I also wanted to investigate the patterns of alcohol use among youth during the pandemic. And finally, I wanted to explore some strategies that could best support the needs of young people during this difficult time. Next slide, please. So UNICEF conducted a survey among over 8,000 Latin American and Caribbean youth to uncover how young people were feeling during the pandemic. And this survey found high levels of anxiety, depression, lack of motivation, and pessimism for the future. And there is some global evidence to suggest that younger adults are experiencing more severe mental health impacts than older adults. And I think that young people are definitely experiencing a very unique mental health challenge. And this is because many young people are in the midst of certain developmental milestones like finishing school, entering the workforce, building relationships, and generally exercising autonomy over decision-making. And all of this is being negatively impacted by the pandemic. And really, even before the pandemic, young people were facing a lot of stress in seeking employment in the context of many contracting national economies and fierce competition for jobs. And this is the COVID-19 pandemic has really only exacerbated this. And it really shouldn't be underestimated that there are long-term mental health impacts associated with youth unemployment. Furthermore, young adults are still developing socially, so the type of isolation and loneliness that young people are experiencing could end up having really negative impacts on health behaviors and difficulties with socialization in the future. And Dr. Monteiro and Dr. Dillett both pointed this out, that there are certain vulnerable youth that really need special consideration, specifically young people who are living in difficult home situations, for example, those who are experienced to violence and substance use. And I'm also thinking about gender and sexuality non-binary youth who may not live in tolerant or accepting households. Next slide, please. So on the question of youth substance use during the pandemic, I found that there was very minimal research on mental health and substance use. So to answer this question, I took a more global approach. And I understand that there's some limitations in terms of generalizability to the Caribbean context, but I do think that a global approach can inspire how this research can be applied in the Caribbean setting and can provide evidence rather to support the need to proactively address the risk of alcohol use among youth in the Caribbean. Next slide, please. So I did a very short literature review and I found 4 studies, 2 from Canada, 1 from Italy, and 1 from China. Next slide, please. And all of the studies sought to understand the changes in mental health and substance use among young people in the Caribbean, among young people during the pandemic globally. 3 of the studies, both Canadian studies and the Chinese study, conducted a cross-sectional analysis of mental health and substance use via online surveys. And the study from Italy was a retrospective analysis of emergency department records with a focus on cases related to alcohol abuse and mental health. So I've included the findings of all of these studies, but I'm going to skip to the summary of the findings. So can we skip the next 4 slides, please? So across all of the studies, youth reported more depression and anxiety symptoms during the pandemic compared to before the pandemic and also compared to other age groups. 2 of the studies reported higher substance use among youth during or after the pandemic compared to prior to the pandemic, and all of the studies found significant prevalence of substance use disorders among youth in their study cohorts. 2 of the studies reported an association between substance use and depressive symptoms. And one of these studies had a few notable findings I wanted to mention, that young people that reported concerns about their reputations were predicted to be more likely to use substances during the pandemic and were more likely to post substance use on social media. The same study found that youth were accessing alcohol and other substances at home and were engaging in substance use with their parents. And Dr. Dillett touched on this a little bit as well. And the study also found that young people were mostly engaging in substance use alone, but a significant proportion were doing so over video chat with friends. One of the studies also found that young people felt that their mental health and substance use needs were not being met during the pandemic. Next slide, please. So in one of the studies, young people discussed the need for economic support. And I mentioned this first because I think that economic support can come in the form of financial support, but it can also come in the form of skills building for youth entering the workforce. I also think that we need to find ways to support safe and healthy social connections, perhaps through hobby development. In the Caribbean, we're blessed with good weather most of the time. And so a lot of these things can be done outdoors where we know the risk of COVID transmission is much lower. And I really think that we need to leverage the internet and mobile technology in improving access to mental health supports for young people. And something I really want to emphasize is the need to engage youth in designing and implementing any of these strategies, especially vulnerable youth. We need to engage young people in this type of research in an equitable way. I think that by empowering youth to define the problem and ideate solutions, not only can young people build skills, we're also more likely to come up with strategies that actually support the needs of young people. Because really it's those who are closest to the problem hold the key to solving them. Finally, and Professor Maharaj and Dr. Montero are going to discuss this further, there must be tight regulations on alcohol marketing to youth, especially in the context of corporate social responsibility during the pandemic. Thank you, I'll leave it there.
Thank you, Ms. Clark-Mendez. That was a really excellent presentation. I was very pleased to see you talk about the use of technologies, mobile technologies and online technologies to reach young people. I think we really need to leverage those, especially since many of our young people are online now. And this is an area which is one of our viewers commented, an often ignored area. And we know that not only adolescents, but children as well are having significant challenges with the pandemic. And so we really need to focus on young people and really come up with strategies. You mentioned last in your presentation, this idea of marketing. And the alcohol industry has been marketing to young people. We're going to hear next from Professor Rohan Maharaj, who is HCC's alcohol technical advisor, and he's going to share a bit about the alcohol industry and their response to the pandemic. Dr. Maharaj.
Yes, good morning, everyone. And thank you all for joining us today at the 5th Annual Caribbean Alcohol Reduction Day. I want to thank Maisha and her staff for really pulling this together at a very, very short period of time. So can we have the next slide, please? I'm just going to touch very briefly on some of the issues that we've been looking at HCC. And so we'll be looking at a bit of some new branding, some corporate activity, a recent publication in which the Healthy Caribbean Coalition has assisted, and then talk a little bit about a new issue on the alcohol horizon, which is the alcohol warning labels that was recently launched in the Caribbean in September and October. Next slide. So I want you to look at this for a minute. At first glance, you would probably not, I wouldn't fault you if you said, oh, a Heineken. But I want you to think about where the word brand comes from. Brand comes from the idea of burning an image. And you could think of it as burning an image into the brain. And if you look at this and you say, okay, this is a Heineken beer. But next slide. If you look a little closer, you'll see this is a non-alcoholic, pure malt drink. Now, the challenge with this is not so much that the Heineken company is providing a malt, but behind the very subtle signals that are being sent to the brain is, one, the color of the bottle, two, the red star, and the Heineken logo. And so what is happening here is that you're getting a lot of young people will see this, and you can see a young person moving from a malt drinker into a beer drinker. And this is sort of very subtle marketing that goes on. This is the sort of thing that we are now starting to see in the Caribbean. Next slide. So during the COVID-19 pandemic, the alcohol industry, and we've been looking carefully at the CARICOM rum producers, they've been modifying their product line, donating heavily to governments, and all behind this were the corporate sponsorship responsibility. Next slide. This is donations from the alcohol industry to school children. Here we see Angostura branded laptops, and we have a lot of evidence of the schools getting money. Schools are being cleaned, malt products being donated. And there have been a lot of support by the regional ministries of education for this. And we have quotes from both the Jamaican and the Trinidadian ministers of education thanking the alcohol industry for their work. I just want to make a small vote of thanks to the NCD Alliance for helping us with the Healthy Caribbean Coalition for their tracker online, which helps to pick up these images and these news items for us to document them. Next slide. So one of the key things the problems that we face in the global alcohol scenarios is the idea of online marketing, because these are inter-country. They're not being controlled at all. They're online, so anyone can have access. So Trinidad can advertise in Barbados, even if Barbados had restrictions on advertising for alcohol. These online messages are reaching across borders. Next slide. And focusing, as you see in this slide, on women. Women have traditionally been the underutilizers of alcohol. They consistently purchase less, use less, and compared to men. And so women have been targeted by the industry. Next slide. And a lot of the advertising seemed to also focus on young people. And there's a lot of evidence from the literature that when young people buy into the brand they click the like button, they go on to use the product in the future. So they get a sense of responsibility for this brand, this burned image into their brain, as it were, and they go on to be a partner and feel that they're part of this brand movement, and very often end up drinking the products of that organization. Next slide. And the other aspect that we've been seeing is the support by members of the entertainment industry, the young personalities here in Trinidad. A lot of the young Calypsonians and soca stars are being hired by the industry to support their products. Next slide. So we're basically building brand goodwill. So the industries have used even the opportunity of COVID to do this sort of work. Next slide. And interestingly, in September and October, we saw this happening, what we call alcohol warning labels becoming present. And if you look at these, you see, well, I'm seeing a rum product, I'm seeing a brandy product. But if you look in the fine print, you'll see the alcohol warning labels. And the problem with these is that they're very often very small. So these are less than about 1 centimeter in height. They're positioned often to the back of the product. And research suggests that there's only about a 50% recall about the messages, and awareness of what's on the message is only about 13 to 30%. So the industry has said that we're doing this as part of our corporate social responsibility, but you see the messages are hidden. They're sometimes graphic and they're not quite easily explained. So next slide. So is there evidence that these alcohol warning labels reduce consumption, and in what circumstances? Well, in my literature search, I was only able to find one study, and that was only very recently published, that said, and this was a study coming out of the Yukon in Canada, that said that per capita sales of labeled products decreased by about 7%, but sales of unlabeled products increased by 7%. But the interesting thing to this, next slide, is that these labels are massive. These are 3 by 2 centimeter labels, very prominently displayed on the bottles, as you see here. So not the very small labels that we see. And the messages here are very clear: cancer, pregnancy, and there's another third message with, oh yes, in terms of numbers of drinks in each bottle. It's not shown in this one. So what they're saying is that you can get reduction in use, but only when the message size is prominent and not hidden, and when it gives very clear messages such as cancer, warnings for pregnancy, and size of drinks that are allowed. Next slide. So in summary, and if you want, you can send me an email through Healthy Caribbean Coalition. I'll send you some more of the information. Can we expect a change in purchasing and consumption behavior from the alcohol warning labels as promoted by the alcohol industry? In summary, no. Next slide. So finally, I just want to close off by just alerting you, members of the public, and our network around the region and internationally about a publication that Healthy Caribbean Coalition was involved with, called The Alcohol Industry's Commercial and Political Activities in Latin America and the Caribbean. Right. Next slide. And basically, it's an opportunity for you to read and inform yourself about social media and digital marketing, sponsorship of festivals, and lobbying within the Caribbean, and the role of the industry in lobbying to develop and control voluntary codes that they want to guide for themselves, using their industry and their contacts to reduce effective policies by working to enhance the passage of weaker legislation. So this is a good document for you if you want to have some understanding of how the industry is working very quietly in the background to defeat the work of governments and civil society. Next slide. So in summary, the alcohol industry has been active during the COVID-19 pandemic, raising corporate image through donations, new products, social media, and the recent launch of the alcohol warning labels. Thankfully, there have been some pushback by the NCD Alliance, by the Healthy Caribbean Coalition, and through this publication, which highlights the work in Latin America. There's still a paucity of good research coming out of the region, and so I invite you, the participants, our public, to get involved, talk to us, and we can see what projects we can get to sort of continue this, being able to recognize and respond, spread the information about how the alcohol industry is working behind the background. to change consumption patterns in the region. Thank you very much.
Thank you, Dr. Maharaj. I wanted to remind everyone that we have the Q&A function. So if you have any questions, please use that to share your questions and comments. That was a really informative presentation, Dr. Maharaj, sharing the actions of the alcohol industry. And I think while we do appreciate that there was a lot of good done, we also do need to balance that and ensure that we protect public health, you know, and it's not used or exploited as an opportunity to promote products to, in particular, vulnerable groups such as young people and children and women that we spoke about. So thanks very much for that. I think we now are going to hear from Dr. Monteiro, our final presenter, who's going to share a bit about the global process right now to feed into the global action plan for the global alcohol strategy, as well as the WHO technical package SAFER, which provides best practice policies to address the harmful use of alcohol and to reduce that use. So Dr. Monteiro, please share with us your perspectives on this. Thanks very much.
Thank you. Next. Well, I just want to remind everyone that in 2010, the global strategy was adopted by the World Health Assembly, and soon after, the Global Action Plan on Non-Communicable Diseases included several actions and policy recommendations and indicators related to alcohol, and was fully consistent with that strategy. And finally, the agenda of sustainable development includes alcohol directly and indirectly. It is part of the target on health and is specifically included as a target 3.5 on prevention and treatment of substance abuse, including narcotic and harmful use of alcohol, with a separate indicator on alcohol per capita consumption. Next. And as you can see, there are several of other goals that are affected by alcohol, and the specific goal, the specific indicator 3.5.2 on alcohol per capita consumption within a calendar year, meaning the countries need to report to the UN annually on APC. Next. And as I said, there are many links of alcohol with other problems, ranging from poverty, hunger, gender equality, violence, water and sanitation, the cost of alcohol related to sustainable cities and communities. So it's not only that indicator, but the relationship with infections, etc. Next. They all have some indicators in the SDG agenda. And these are the 10 areas of action of the global strategy, and out of which we have 3 that were included in the annex of non-communicable diseases framework for global action related to what was known the best buys on affordability, accessibility and marketing of alcohol. And later on, the screening and brief interventions were also in health services was added as a very good buy, even though it is not a best buy, but they are effective and they need can be implemented. And drink driving policies, they are not for the whole population, but are cost effective as well. And in our region, when this is an important cause of death and disability, road injuries. Next. I showed you that already, that the trend is not good in the region. So there is a lot of work pending to be done to reduce per capita consumption in the region until 2030. Next. And this is the situation. Only 8 countries in the Americas even have a national written alcohol policy that has been adopted, regardless of what it does include, at least, but it is an important document that all countries should have. None of the Caribbean countries have such a policy. Next, oh, except the Bahamas. Here in alcohol taxation, we do have most countries with taxes, but they are not having their impact on prices and affordability of alcohol. Next. The minimum legal age, there is a wide variation from non-existent to 16 years of age up to 18 in the Caribbean countries. Next. The restrictions on alcohol sales on premise and off premise are also in hours, days, and locations is not consistent, and some have, at least in the law, we don't know about the enforcement. Some others have nothing. Next. The regulations on alcohol advertising and sponsorship is the least implemented in countries of the Caribbean. We are very far from any alcohol market statutory control of marketing. Next. And for drink driving, we are also not consistent, and only Suriname has for adults the limits recommended by WHO. All others are not meeting the WHO requirements. For young people, it should be 0.02 grams per deciliter maximum for driving. Next. So in 2018, and reflecting the small changes, actually improvements that happened globally on the implementation of the alcohol strategy, WHO launched the Safer Initiative with the objective to promote, advocate for the implementation of 5 policy areas, which are the most important, but they at the end are consistent with the global strategy. Next. SAFER is an acronym for the 5 areas that are recommended on restrictions of availability of drink driving, screening brief interventions, marketing controls, and raising the prices through excise taxes and other pricing policies, but to reduce the affordability of alcoholic beverages. Next. A technical package has been published. We have translated into Spanish and Portuguese. For the Caribbean, it's available in English, and it is a guidance to the countries based on the evidence and with the essential elements that should be put in place, and how on developing a national policy with these 5 areas at least. We also call other sectors and their role in that, because, for example, taxes depend on sectors outside the health sector. Next. And this is just to give you an idea that implementing those taxes in particular have a tremendous impact on deaths averted, compared to tobacco and to SSBs. The gain is it's very important for alcohol, just tobacco is higher than that in terms of deaths that can be averted over, this is globally, over a 50-year period. Next. And years of life gained, it is slightly higher even than tobacco, and incomparably higher than with SSBs in terms of projected health and revenue impact. Next. And the changes in tax revenue, meaning that is increasing revenues for governments over time. It is also the most, is the best buy of all policies that can be implemented in terms of taxation revenues for governments that can be used for a variety of reasons. And in the recovery of the pandemic, they'll begin to have discussions on using taxes to raise the revenues needed to recover the health sector and the economy, and alcohol taxes are one that can do that. Next. The SAFER initiative required 3 key strategies implemented by the countries: implementing the regulations, protecting them from the influence of the alcohol industry, and based on scientific evidence, disclosing and managing conflicts of interest, and monitoring how things are going in harms and consumption, and adjusting policies as needed. Next. You can consult the WHO pages. There are new pages in the WHO website related to SAFER. Next. We published in the BMJ a plea for related to SAFER and why we should be prioritizing alcohol. Next. Various here by the Healthy Caribbean Coalition, there were already seminars related to SAFER in Brazil and all over the world. Next. And this is the last one. And WHO started following executive board resolution. They started to develop a global action plan, and it started a few days ago, and going until the 6th of December. The process is now open of public consultation. NGOs, governments, non-state actors, intergovernmental organizations can provide feedback on the draft document. It's online and in any of the official languages of WHO. It's not for individuals to post their comments. These are for organizations or governments. And we will organize also a regional consultation early next year on the document and contribute to this process. So I ask everyone from any organization to participate, contribute to this. And I think that's all. Next, thank you.
Thank you, Dr. Monteiro. Can I please invite all of the panelists to turn their cameras on and unmute their mics? And let's begin our roundtable question answer session. So we have a few questions from our audience. I'm going to start with a question received from Mrs. Marcia Munnings. She's the head of the Healthy Bahamas Coalition Secretariat. And she says, there are some common myths about alcohol's role in treating the virus. Can you name and address some of these myths? For example, alcohol can destroy COVID-19. Consumption of alcohol stimulates the immune system. And we've heard Dr. Dillett talk about this one. Alcohol in the breath kills the virus in the air. Does anyone have any feedback on those? How do we tackle these myths?
Well, I think with public education, WHO also, in PAHO, we published a fact sheet on myths related to alcohol and COVID and explain what are the facts. And this needs to be constantly reminded to people. Alcohol does not protect, it's the opposite. It can be a risk to contract COVID because it is a substance that is immunosuppressant. It does not protect infection when you drink, except when you use pure alcohol on your skin to protect just for cleaning purposes, but one should not be using that at all against COVID. Use the mask, and washing hands is also cheaper than that. Inhaling does not protect at all, does not treat, and alcoholics or alcohol-dependent people are at risk of severe consequences of COVID. They will get COVID as well if they are exposed.
Thank you, Dr. Monteiro. Would anyone else like to respond to that question?
Yes, just to reinforce, the best way that we could actually boost our immune system is by healthy living practices. Exercise, eating fruits and vegetables, making sure that we have enough vitamin C and zinc and other vitamins and minerals that boost immune health, such as your antioxidants, for instance. Decreasing stress through meditation, yoga, and as I said, exercising at least 3 times a week. That actually will go a far way of allowing us to boost our immune system. Unhealthy practices such as smoking and increased amount of alcohol use actually will do the reverse. So for anyone listening, please don't give in to those myths. Healthy lifestyles promote healthy bodies.
Thank you, Dr. Dillett. Ms. Munnings also asks about this commonly assumed idea that 1 glass of wine a day is okay. You know, when we think about, what level of alcohol consumption is safe, I think this is something that confuses the public. Can anyone share any opinions on that?
I can jump in again. Alcohol is known now that to cause cancer. It is a cancerogen, a substance, just like tobacco or asbestos, so there is no safe drinking in that regard. Even a small amount, you adding a toxin in your body. And of course, it depends on the amount, building up over time to cause cancer. But the idea that 1 glass will protect your heart, well, it may, but at the same time will be causing cancer. So this needs to be dispelled, and we are whole bodies. We are not just some parts that walk independently or not of each other.
I think it's also important that we remember that alcohol, how the body handles alcohol, changes over time. And what you can cope with when you're a younger person, when you're a large male, is totally different from when you're a female, and changes as we get older. But the research is, again, very compelling recently. The risk of zero drink is the best way to go. That any amount of alcohol can be dangerous is something that we have to keep reinforcing to people, because we've got this culture in the region that is part of our macho-ness, that is part of our village life, that is part of our community life, because our foundation of the development of Caribbean peoples have been based on things like cane production and sugar cane and alcohol production. So we think it's part of who we are. And that is unfortunate, because it's utilized very often by, how our products are sold. In Trinidad, it's called a man's beer. This is Carib country. It's built into our system, and it's used by the industry to really, hit us at a very subconscious level. And we need to always be aware of how that marketing is affecting us.
Well, on top of this, also the same amounts, or there might be low, even for young people, they impact on the injuries. And these are the causes of death of young people. So it's not because of their heart that they're dying, it's because of a gunshot or a fight or a car accident or suicide or falling or drowning. And so what benefit is for the heart if you're dying before that benefit can be accrued?
Yes.
In the HIV epidemic, we also saw there was a role in terms of reducing inhibitions and becoming sexually active. So it has that other aspect that's very critical for young people to remember that.
I just want to add as well that alcohol has a high caloric content and sugar content. So again, from that perspective, in terms of your health and well-being, the impact on NCDs as well and obesity. So it has so many impacts as we have highlighted here as well, yes.
And it's interesting that it is promoted to young people and women as sugary drinks, usually combined on, and that will bring another risk factor to the cardiovascular disease later on, already in young people, and people don't connect those dots.
Thank you. The other question we have is from Shamdio Prasad in Guyana, and he's saying, did anyone look at alcohol use and its effects on health workers? we've seen increased issues with alcohol abuse among healthcare workers, especially those on the front lines.
Yeah, I don't have information from surveys. I don't know if they included questions on alcohol. There are some surveys ongoing among healthcare workers and their mental health during the pandemic. And it's understandable that they would try to use as well, like everybody else, trying to use alcohol to cope with their situation and mental distress, but it's not a good coping mechanism. It's important for everyone to be aware of the need to reduce their drinking and not increase during these times.
I'd be interested to hear from anyone else in the panel if they've seen in any of their countries policies or programs in particular that have been put in place to assist healthcare workers around mental health and subsequent use of alcohol.
Just before I spoke to that question, the last question I'd also like to respond to. If you group healthcare workers in the essential worker class, then you do see some studies from the past that show an increased use of alcohol compared to the general population, trying to self-medicate for the enormous stress that they find in a job. Police officers, firefighters, healthcare workers, paramedics, things of that nature. So there is evidence to suggest that alcohol use in essential workers is perhaps a little bit higher than the general population. So we have to be mindful of that. As everyone is under enormous stress, persons self-medicate, and we go to unhealthy practices because they're more convenient, perhaps, and it's perhaps less stigma looking at mental health and how we're not coping well and reaching out for help, as I think some statistics in Dr. Montero's presentation showed. As a result to policy, it's incumbent on all countries to take this very seriously. The general medical impact and the mental health impact is enormous as a result of the complications that go with inappropriate alcohol use. When you look at lost days from work, injuries, days spent in hospital, it is quite significant, the impact that it has on a particular country, on your GDP, for instance. So it is something that I know in the Bahamas it's becoming more of an issue, and they're looking at measures. Certainly we have community counseling centers and a lot of outreach. We're trying to do our best with encouraging students at a very young age and warning them of the pitfalls. So I know certainly from the Commonwealth of Bahamas standpoint, the government of the Bahamas is taking it very seriously and trying to incorporate various programs to assist.
Thank you. We have a comment here for, which I'll direct towards Safia. We should consider robust health education for students to understand the consequences of substance abuse, alcohol, tobacco, and basically communicating that not starting is the best strategy.
I think that's a great point. And I do think that young people have the tendency to think that we are somewhat immune to certain, or maybe immune is not the right word, but I guess somewhat more resilient to certain health issues, or maybe see certain health issues, especially the chronic diseases that are associated with alcohol. We see those things as future problems that are so far in the future that we can't really even think about our behaviors today as impacting our risk. I do think that messaging is really, communications and messaging is really crucial for reaching young people. And I guess, I mean, I'm really just such an advocate for participatory research, but really the only way that we're going to understand what types of messaging resonate with young people is to include young people in those types of processes. What I've found in my research is that young people don't really respond to negative and fair messaging and are more partial to gains messaging, more positive messaging that's focused on health gains, like what can you achieve if you engage in certain behaviors or if you don't engage in certain behaviors, as opposed to these are all the terrible things that will happen to you if you do this. And also important in those communication strategies is providing alternatives. So it's really one thing to tell young people don't do something, but what should we be telling them to do instead? I think that's also a really big part of very big part of it.
Thank you, Safia. I noticed in Dr. Montero's presentation, and we're well aware of this, but the audience may not have known that the Caribbean has done extremely poorly in terms of implementation of alcohol policy. In fact, amongst the risk factors, I mean, one could comfortably say that we're the most behind in alcohol regulation. So I wondered if the panelists could comment on why do you think that, that's the case? Why are we so behind? What have been the barriers? And does industry interference feed into this? We've noticed this in food policy, that industry interference is a factor in delaying or diluting food policy. And we've seen this with tobacco as well. Can we talk a bit about why we've been so slow to make progress with alcohol regulation across the region?
So I think there's several countries which have made attempts to advance their policies or put policies in place. But as you remember, the policy process is one that requires the highest political commitment. It requires going through cabinet, a process. And I think this is where industry or other interference can hinder the process of moving that policy forward. What should be in that policy? What can we compromise on? Should we have tax? Can we have labeling? Everybody, and then it's a multi-agency, a multi-government, all agencies in government and the sectors have to have that input and dialogue. And this is one of the challenges, moving that process along from where it's a concept paper, which is approved by a cabinet, to a green paper, to a white paper. This takes in a lot of different stakeholders. And if stakeholders don't understand the importance of all the different elements or don't support that, and remember that you're also impacting on other industries outside of health. And so it takes a lot of advocacy and support around that. So I think that is one of the things that are hindering moving this process along. Also, you also have to have the support and technical expertise to understand the different arguments with respect to industry. And so the same challenges that you saw around tobacco, moving that process forward, and around this front of packaging labeling in the food industry, it's a similar challenge that we're seeing moving along. One of the steps, again, we're taking at a Caribbean regional level through CARICOM, through COSAT, and the work of COTAT is to come up with a regional strategy for the Caribbean to move this along. However, technical support over time, similar in the area of tobacco, that technical support in the area of food to countries have helped to move that process along. And of course, what is critical is civil society advocacy, to engage all the stakeholders to get buy-in and an understanding of the need for such a policy. But you also can't only have a top-down approach, you have to have a bottom-up approach. So you also have to educate the population on the importance and the health impact of alcohol on their health to support this process. Because of course, from a political aspect, the support from entities rely on also the opinion and input of their populace as well. So it's going to be a multi-dimensional, multi-stakeholder approach to really moving this policy forward. But I think the major hindrance is that interference or misinformation around, and probably lack of knowledge and understanding as well around why we're implementing some of the policy issues. And also we may need to generate some more data to support some of the policies that we want to put in place. But really, I think if we take the lessons learned from tobacco and from food, we can help to support and move some of these policies, which are already in train in several countries, for example, like Jamaica, Belize, and some of the other countries have already moved to a draft state, but need that additional support to move it along through the process, legislative process.
Thank you, Dr. Davidson. I've got a related question from Dr. Mortimer Moxie of the Bahamas on asking panelists to speak a bit about tourism and alcohol. And to me, this is a strong link between that industry interference that we're talking about and the vested interests of private sector. Does anyone want to speak on that? And I'm conscious of time, so if you do, we can keep your answer to brief.
Just want to give my 2 cents in that, because countries in the Caribbean can protect their populations, but still continue to work with the tourism industry and allow the drinking, and that relates to that. People who come to the countries in the Bahamas, they come because of the beach, because of the environment. They don't come exclusively to drink. So it's part of a package. And even if the cost increase for them, that is minimal, if at all, it makes a difference for their decision to come or not. But leaving the prices so low for everyone is a risk for their own populations. And the tourists suffer when the own population is drinking and put them at risk, for example, on a car accident. They are run because they're walking, or if they get involved, even when they drink. And we have done some preliminary study on the potential impact with Euromonitor in Jamaica, study like that, and they concluded there wouldn't impact. And what happens is, when the tourists don't drink all that they have imported for them, they sell at a discount to the local population. So it's a double suffering for the locals, actually, because the availability increases.
Thank you, Dr. Monteiro. So we've got about 2 minutes left, and I'm going to give each of the panelists an opportunity to provide some closing comments. And I'm thinking, 1 sentence each, just summarizing any key messages that you'd like for the audience to take home. So I'd like to start with our HCC alcohol advisor, Professor Maharaj.
Yes, hello everyone. So first of all, I just want to thank everyone for coming out. This is probably our largest audience ever. It means that we're making an impact, we're getting out, people are becoming aware and interested in this topic. We want you to go to your organizations. I think the step that Marcella promoted there, getting your organizations to respond to the WHO inquiry about response to their paper on alcohol, it's very important. It's an opportunity that doesn't come along very often. And please talk to your organizations about getting involved. Thank you.
And we'll go next to Dr. Davidson.
Yes, I want to highlight there, alcohol, the impact of alcohol affects each and every one of us. All of us have some personal experience. So I think it's critical for us to raise our own personal awareness about alcohol and its effect, to engage our stakeholders in the member states, to find out what's happening with respect to our own policies, and to support some of the policy process. This is not an overnight success. It's a journey that we'll have to take together towards achieving success in addressing alcohol. And I believe we can do it. We have done it with tobacco to some extent, and we're continuing to do it with food. So join us on this journey as we move towards addressing this major public health problem. Thank you.
Thank you, Dr. Davidson. And I'll go to Dr. Dillett.
Thank you. I just want to say that the coronavirus pandemic has had such a huge impact on all of our lives. It's affected each country's economics. We've had hundreds of thousands of people die around the world. We've had millions of people infected. But one of the things that tends to get lost sometimes is the mental health aspect. We already have a mental health pandemic, if you will, across the world, where people are under enormous amounts of stress for many, many reasons. And there's still so much stigma associated with mental health and person's ability to speak about it to loved ones or to gain access to professionals. And the pandemic certainly has just simply made it even worse and highlighted the deficiencies even further. So during this time, I really think we have to remember the mental health impact and let people know that there is help available, there is support available. We have to be mindful of how this impacts our loved ones and our co-workers and our colleagues. And for everyone to do their part to put that message out there that we are all going through this together, and together we can help each other to find a way to the finish line. But thank you so much for the invitation. All the panelists have been wonderful and excellent. I have great admiration and respect for each one of you. Thank you again for the invitation.
Thank you, Dr. Dillett. And Ms. Clark-Mendez.
I just want to thank the HCC and all of the panelists. This has been a really great experience. I really wanted to emphasize the need to creatively come up with supports and services for skills building and mental health for youth during the pandemic and onwards. And I think this means facilitating professional skills building, but also creating opportunities for young people to do other things that aren't engaging in substance use, and supporting professional development moving forward, given just these very difficult times that we're in. Thank you.
Thank you, Safia. And Dr. Monteiro.
Thank you very much. I also appreciate participating here. And I think we need to be conscious that we are at a crossroads now, that as we move out of the pandemic, it is the opportunity to build back better, as it was is promoted by WHO. And that means strengthening the policies and not having the worst coming now. As we open businesses, we go back to public and mass events that all include alcohol, and that can lead to a rebound of problems that were never seen before. Because added to that is what has been developed during the pandemic, the very efficient delivery system. Go, have your cold beer at home at your door. And that added to the expected promotion of activities, the happy party after a vaccine, etc., and all this type of events that that we missed. All, for example, the festivals, Carnival will come, and how can we prevent the added problems related to alcohol consumption? It will be through the measures that we know already work. They have not been implemented in full. It's time now to build back better.
Thank you, Dr. Monteiro. And on that note, I would like to close and thank everyone. The HCC in 2 weeks will be launching our transformative new agenda. And this is really about, as Dr. Monteiro said, building back better post-COVID, and really taking a closer look at the way we've tackled NCDs so that we can almost start fresh. And taking a closer look means tackling the risk factors. And one of the major risk factors is alcohol use. So we need strong policies, strong regulatory environments. And part of getting to that place, as Dr. Davidson says, is a strong social movement where we have all stakeholder groups, youth, people living with NCDs, those affected by mental health, alcohol, really rising up and telling governments we've had enough. It's about rights, and we really need action now, and we need to protect people and really reduce NCDs. So on that note, I'd like to thank everyone for joining us on this 5th annual Caribbean Alcohol Reduction Day, and we hope to see you again next year. Thank you.